Good afternoon, everyone. Thank you very much for joining us today. My name is April Wepler, and I am the Engagement Coordinator at the Canadian Environmental Law Association, or CELA. And thank you for joining us for today's webinar. We're pleased to be co-hosting today with CAREX Canada, and you'll hear more about both CELA and CAREX in just a few minutes. We are running this webinar a little bit more informally. We're using Zoom meeting. We would ask that you keep your microphones muted and your cameras off during the presentation portion, but we will have an opportunity for questions and discussion after the presentation. And at that time, you're welcome to turn your cameras on and unmute, and we can have a conversation. We are recording today's presentation portion, so it will be available for other legal clinic staff to view, but we won't be recording the discussion portion of the webinar. Please feel free to introduce yourselves in the chat box. We'd love to know who's on the line with us. And you're also welcome to share a land acknowledgement. And on that note, CELA acknowledges that the lands and waters on which we live and work are the traditional territories since time immemorial of Indigenous peoples, including First Nations, Inuit, and Métis communities. We acknowledge that Indigenous communities across Canada have distinct cultures, traditions, and lifestyles, and we're grateful to have the opportunity to live and work on these lands and waters. We recognize that we have a great deal to learn and a significant amount of work to do to address historical and ongoing environmental injustices imposed on Indigenous peoples, including the denial of access to justice. And personally, I live on the banks of the Speed River, where I'm privileged to live on the traditional lands of Anishinaabeg and Haudenosaunee peoples, and on treaty lands of the Mississaugas of the Credit First Nation and Six Nations of the Grand Watershed. So as I said, please feel free to introduce yourself in the chat and share your own land acknowledgement if you would like. So during our webinar today, we will be hearing first from Teresa McClenahan, Executive Director and Counsel at CELA. And then Teresa will pass the mic over to Cheryl Peters, who is Principal Investigator with CAREX Canada and Senior Scientist for Cancer Prevention with BC Centre for Disease Control and BC Cancer. And so without further ado, I will pass the microphone over to Teresa.
Great. You didn't want to do the Zoom housekeeping?
I did it out loud. I forgot to put the slide up, but I think people got it.
Yes, welcome everyone. I'm really excited about this day today. We've been talking to CAREX about a webinar like this for a while, and you'll find out more about our work together in a couple of minutes. But this presentation today is directed at clinic staff across Ontario, and CELA is one of the specialty legal aid clinics dealing with environmental equity, justice, and environmental health. We were founded in 1970, and we've been funded by legal aid since 1978. In fact, we were one of the pilot clinics in the 70s when people understood that environment was a critical aspect of social justice. And the understanding of that concept has ebbed and flowed over the years, but now we're in a time where fortunately it is becoming much better understood, and now we're starting to really explore what that means, as you'll see today in this presentation. And of course, all of you know what legal clinics are, but our services in particular relate to environmental justice across Ontario. And although we're a specialty clinic, we do representation, summary advice, as well as systemic work, test cases, jurisdictional cases, as well as public legal education, direct with communities, and a great deal of systemic work in the law reform vein. And we work extensively in partnerships with other clinics, with community service providers, with networks advancing environmental justice. Next slide. And just a quick word, we also have an affiliated charity called the Canadian Environmental Law Foundation. Those of you who've been in the system for a long time may recall this as the Resource Library for the Environment and the Law, but we renamed it on the advice of our auditor in 2019. And one of the new things is that that foundation does do direct fundraising support to assist our education programs, including our articling program, which we've had continuously at CELA for over 50 years. And we're very pleased that we have provided a lot of capacity in terms of social justice with our environmental education program. We also do public outreach, education, um, uh, and a number of initiatives, and we have archives and environmental history, all of which are rich resources for people working in this area. Next slide.
Those are all the opening slides.
Okay, thank you. All right, so I don't
have.
have slides per se for what I'm about to talk about because I'm leaving all the limelight for Cheryl. But as I mentioned, we've been quite keen about having this presentation about the work of CAREX and particularly about some of the tools that CAREX has that can be useful to us as clinic advocates. And I'm very happy that some of my colleagues from CELA are also participating today, as well as Zee Banji, who's staff of both CELA and ACTO for our low-income energy poverty program. And because it's the kind of thing where I think just sending an email around to say this is a great resource doesn't at all do it justice. So I'm really looking forward to today's presentation. Cheryl will introduce CAREX further, but CAREX Canada and CELA have had a long-standing, very close working relationship over many years on a number of issues of common concern. And so I just pulled out an overview from the most recent little while to give you a picture of that so that you can kind of see how it might relate to the work you do in other specialty clinics or in community legal clinics across the province. So one area we've been working together extensively for many years is the area of radon. And we exchange information, we help each other know about consultations and participate in those consultations federally and otherwise. We do have litigation going on right now. There's an update in today's bulletin that CELA just issued, our monthly bulletin, about litigation relating to people in Elliott Lake who are sitting on mine waste and have very high radon exposures in their homes, a long-standing environmental justice issue. CAREX has interesting programs like Evict Radon, with a joint study on changes in radon exposures at home during COVID, as well as knowledge translation for First Nations. And I'm sure Cheryl might choose to expand on some of these things that I mentioned at her discretion. We also have joint interest in the work around lead in drinking water. And CELA has had a campaign on this issue for many years. In fact, we worked on lead in drinking water ever since it arose in 2007 as an issue. And we revisited that issue a number of years ago to find out whether the full problem had been solved. And we especially have been focusing on lead service lines, i.e. the line that goes from the street to the house, because in older communities, that is the main reservoir of lead remaining to provide a threat to drinking water. And so that's a common interest that we have. And similarly, CAREX has been working on lead exposure inequities in schools in BC, and CELA's also done some work around school exposures in Ontario. Another area we have common interest in is work on asbestos. And of course, because CAREX does so much work on occupational health, as some of the other legal clinics already know, we have some overlap with those other clinics, with CAREX and with many other advocates about reducing exposure to asbestos in the population and workers. And so, for example, to give one recent example, CELA was part of a request for Canada to develop an inventory to better understand cement water pipes that contain asbestos still in place in Canada, and calling for a drinking water guideline for asbestos. Then we also have common interests in the area of pesticides. So CELA has worked very intensively for pretty much its whole existence on pesticides. For those of you, most of you are in Ontario, and the fact that we have a ban on cosmetic use of pesticides is very largely due to CELA's work, along with our colleagues at CAPE and other NGOs, and we were instrumental in that work. Most recently, Faye has been participating in a national water monitoring pesticides project because we found over the years, as is commonly the case where government attention on issues also waxes and wanes, that our understanding of pesticide releases and incidents in fresh water had really started to take a back seat, and so there's been a new focus on that. Then environmental inequity is a common interest as well. CELA is working on updating our Great Lakes and pollution and poverty maps, which I'm very excited about. They should be out early in the new year. I think Cheryl will talk as well about some other mapping opportunities, including CAREX's own and some that are forthcoming that really provide some pretty tangible pictures of where environmental inequities are occurring and why. Similarly, CELA's worked with the Toronto Atmospheric Fund very recently, as well as Climate Action Partnership, in advocating tools like municipal bylaws for heat standards. We have some active work going on there with partners, including some other clinics, and building performance standards, again, looking at climate from a vulnerable communities lens. And then we've got quite a lot of other work we're both doing around equity and environmental releases like benzene, shade, looking at landfills and drinking water, respectively. And then some really interesting recent developments in Canadian federal law around rights to a healthy environment in the new Canadian Environmental Protection Act. We had some reservations about that in terms of enforcement, but nevertheless, we will encourage everyone to make the most of that new tool, as well as new legislation that we hope is forthcoming regarding environmental racism. And the federal government set up, much due to advocacy by us and David Suzuki Foundation and others in the Green Budget Coalition, just recently set up an Office of Environmental Justice within Environment Canada. So that's very, very exciting work. That's just in its infancy. And then I'm hoping that Cheryl will say a bit more about their work with Canoe in her remarks, so I won't try to do that justice. So that gives you a picture. For clinics, you know, healthy homes, healthy communities, access to safe drinking water, to safe air, to safe indoor air, thinking about issues of poverty and energy, low-income communities and tenants in terms of consent to exposures like pesticides imposed by landlords. These are all issues that cross all of our areas of practice, and I'm hoping that today, among other sessions, are opportunities for us to explore those together. So I will stop there, April, and Cheryl, I will send it over to you.
Great, thank you, Teresa and April. I'm just going to get my screen ready here. Okay. Okay, hopefully you're seeing that properly.
Yeah,
great.
We can hear you, Emma. It's just, or sorry, sorry, Cheryl. It's still a little soft, so if you can just speak up a bit.
Okay, yeah, I will try to speak up a little bit. I've got my speakers up as loud as they go. So thank you so much. Very happy to be here. And thank you, Teresa, for touching on a few things there. Good reminders for me that I took notes to mention in my slides, because we did keep it relatively brief and high level to speak about sort of what we do at CAREX in terms of looking at exposures to carcinogens. We've mainly focused on the environmental work, just knowing who's here today and who was going to attend, but I will touch a little bit as well on our occupational exposure estimates. And maybe just on the last slide, I might elaborate on a couple of those projects that you brought up, Teresa, that I think do cross both of our areas of interest. I know we've had a land acknowledgement already from April, which was wonderful. This is the land acknowledgement we use at CAREX as a national organization. Our work extends across the borders into many Indigenous lands across Canada. So our host institution is based at the University of British Columbia, which is on the traditional, ancestral, and unceded territories of the Musqueam people. And just today, I'm joining you from my home on the traditional and unceded territories of the Esquimalt and Songhees nations. So I'm going to talk a little bit today. I know there's probably a varied level of knowledge about CAREX in the room here. So I'll just talk a lot about what CAREX is, what our scope of work is. I am going to show a little video of eWork, which is our occupational exposures tool, and then I'll touch on some of the projects in a little bit more detail that Teresa's just brought up, and maybe a couple of others that came to mind that might be of interest to the group. Really at CAREX, we're kind of a multi-institution, large team I will talk about this in a minute, but we were funded by the Canadian Partnership Against Cancer in 2007. So we are a research program, but very unique in that we've had this long-standing and not now non-competitive funding. So it's such a unique opportunity, and it's allowed us to really grow. But CPAC really funded us to develop these suite of estimates, and I'll talk more about them later, but estimating exposure to environmental and occupational carcinogens. But we, from that base, have really expanded out to do a lot of other work in environmental justice, supporting work for unions, working with workers to reduce their exposures, a lot of different working groups, including this long-standing one we have with CELA. But our work kind of, it spans a little bit more than what a lot more than what I'll share today. So from that sort of core funding we have from CPAC, our purpose has been to provide a body of knowledge about Canadians' exposures to known and suspected carcinogens. And we really, we generate this information to support organizations to prioritize exposures and to develop policies and programs that can reduce them. So we're kind of that academic piece, providing scientific information to organizations that we hope can use it to reduce exposures to carcinogens. Like I said, we've been funded by CPAC for more than 15 years. And we know at this point we'll continue to be funded by them until 2027. There's always hope it will be longer than that, but perhaps not. But we do get funding from other sources, including the Canadian Institutes of Health Research, including some provincial funding sources, especially WorkSafe BC, other groups that are doing more occupational health related information. I will touch on that project we have with Canoe at the end, but that's actually funded through the Ministry of Health in Alberta. So we get funding from kind of a variety of different sources. The main core of it is CPAC, but we do try to diversify our funding just so that we make sure that we're doing things that are interesting and supportive of people who are trying to reduce exposures. So as I mentioned, we are a multidisciplinary team. This is everybody pictured here now, except for maybe a couple of students, but we span multiple provinces, multiple types of expertise. So I'm an epidemiologist by training, as well as an occupational and environmental hygienist. We have people who do a lot of work in exposure assessment, in GIS and health geography, in policy, and a really strong core of knowledge mobilization. So, we're generating these estimates and these other high quality pieces of information about environmental and occupational health. But we really want to make sure that it's getting mobilized. So we spend a lot of our time in partnership with our key partners, as well as stakeholders who we think might like to use our information. So we really try to guide ourselves with this vision and mission statement. So we are really here to try to reduce the risk of cancer. I mean, that's basically what it boils down to. Another big piece that I think mirrors a lot of what CELA does and probably underpins and is why we've had such a long-standing and great relationship is this effort to reduce exposure inequities. So we have a justice focus to what we're doing, both for workers. We don't think that workers should get sick and die from their job. And we don't think people should get sick and die from their environment either. We do, that really does underpin what we are trying to do. Cancer is still the #1 cause of death in Canada. And so it remains of paramount importance for groups like us to work together to try to create information that's really useful, provide a unique set of expertise, and then try to help different groups to mobilize that knowledge. So we offer a suite of different tools and resources for folks to use. So the sort of main page, if you've been to our website, which is carexcanada.ca, is the substance profiles. And so for each carcinogen or suspected carcinogen that we look at, we have a profile about it, which has a whole bunch of different pieces of information on how people are exposed at work and in the environment. What types of regulations exist for these substances in Canada, information about routes of exposure. And right from that landing page, you can also then look at the environmental estimates and the occupational estimates if they exist. So you'll see we have more occupational estimates than environmental. simply just because the level of detail is often quite a bit better in occupations. And we had sort of a set of data to start with when we began CAREX Canada to look at the occupational piece. So the environmental estimates are unique to the Canadian CAREX system. So there are other CAREX systems in the world. No, none of them have an environmental component like we do in Canada. So that's a really unique addition that we have to our project. We also have our main interactive tool that we have is eWork, and I'll show you a video of that shortly. We can also make package summaries, and we do, and usually these are based on requests from our partners. So if someone says, hey, you know what, I'm from the province of BC, can you make me a package talking about the top 10 exposures in BC? Or perhaps we'd be approached by a certain union who is interested in exposures for a type of worker, maybe a welder. We can create a package about all the information we have about things that happen in terms of exposures to welders. And we also have a set of priority exposures. We revisit that every year. It doesn't often change that much because our priorities are similar. And Teresa, you brought up some of them, including asbestos and radon. These are some of the, the biggest threats still, both occupationally and environmentally. And so I don't see those dropping off of our priority list anytime soon. We also have a strong focus on Indigenous environmental health. And I think I have a couple slides to talk about some of the projects that we've done in partnership with First Nations communities. And that's certainly something we're trying to grow on our team, knowing that it really does sort of get to that core of thinking about our relationship to the environment and thinking about justice principles, really supporting Indigenous communities to have safe and quality environments is of paramount importance to us. So I've talked a lot about these estimates and, doing the science behind the scenes a little bit. We actually get all of our data to do this work from publicly available sources. So this comes from provincial and federal governments, published information in the literature. A lot of our occupational estimates rely on actual measures that have happened in workplaces. And we do a lot more qualitative work, I would say now, by talking to experts, doing key informant interviews, doing environmental scans, having focus groups to kind of dive deep on some of the bigger questions that we have. And we are peer reviewed in what we do. We have advisory committees that are sort of set up as needed. When we're kind of creating a new suite of estimates, for example, we will select a new committee to say, hey, we're coming out with a bunch of work and we'd like to have it reviewed by experts. So we really do want to have a rigorous process to how we do our work. So we don't sort of review what are the causes or not causes of cancer. We rely on the International Agency for Research on Cancer at the WHO. And I've sort of alluded to this a couple of times. We focus on known and suspected carcinogens. So the types of classifications that IARC does are on the screen there, group 1, group 2A, and group 2B. So there has to be some evidence that these substances can cause cancer. So there's some things that are on our list. In fact, a lot of things that are on our list in that group 2B, where perhaps the evidence isn't settled yet for humans. That's typically why something gets into 2B. It's sort of a known animal carcinogen with less evidence in human populations. But we still, the way that we kind of decide to include some of those things is based on the likelihood of presence and or use in Canada. There's a toxicity element to it as well, which includes whether or not, those classifications from IARC I just had up on the previous screen, but it does include other health effects. So that's where some of these important environmental toxins and occupational toxins stay on our radar. Is okay, maybe the evidence isn't there for cancer, but they might cause reproductive effects. So that's a great example for lead and why we focus on lead. Evidence for it causing cancer is pretty weak, but evidence for it causing neurodevelopmental and reproductive outcomes is very strong. And so that's definitely worth our while to kind of spend some time on that. This also includes a lot of the pesticides that Teresa mentioned as well. Many of the ones that are in use in Canada now are in those IARC 2A and 2B categories, but we know that they have all these other negative health outcomes for people that makes it important to look at them. There does have to be an element of feasibility. So we do have to have enough data because we rely on publicly available data sources. We aren't just going to kind of make something up. We need to know that we have something to hang our hat on so that everything we're doing is really grounded in science and will be able to be used to reduce exposures. And we do consider special interest from the public and scientific community. So the way we do that, usually it's sort of like an on deck thing, I would say. We have a special topics page about an emerging thing that we're sort of seeing coming up in our news scan. So some of you might get our carcinogens in the news digest, where we really keep on top of how carcinogens are being spoken about in the news. And we put out this digest, an internal one to our partners, and then an external one that goes out a bit more broadly. So we do keep it on our radar that if there's special interest in something, let's get it up on our radar. Let's wait to see what happens when IARC reviews it. And if IARC kind of puts it up at a 2A or a 2B and we have enough information, that can be something that we then create a full profile on. And so we do add new agents to our list of things that we're focusing on constantly. We're really keeping on top of that. So I'm going to just touch, I'm not going to go into too much detail on these because I think that the results are a little bit more interesting to you folks than maybe how we're actually doing this behind the scenes. But I have two slides that look like this, one for the environmental estimates and one for the occupational estimates. So on the environmental side, our data products are the way that we kind of share our information on cancer and carcinogen exposures is to calculate a lifetime excess cancer risk. And I'll show you how that shows up in the next slide. But basically, we're then looking at all the different ways that people are exposed in different media, sort of different routes of exposure, whether that's outdoor air, indoor air, food, and we kind of ball this all up into a potential lifetime excess cancer risk, which is different from what we do on the occupational side. And it really allows us to kind of rank by importance what are the exposures in Canada on the environment side sort of occurring in the general population that are kind of getting into a territory of increasing cancer risk by an unacceptable amount. So the way that this is envisioned, and you can see this graphic on our website, this is the lifetime excess cancer risks. And so for context, typically Health Canada considers a lifetime excess cancer risk of 1 in a million to be acceptable. We can have a debate or a discussion about whether it should be lower than that, but that's typically where they'll sort of set their risk assessment values. Other groups might have more of a 1 in 100,000, sort of acceptable risk, but that's generally where Health Canada places it. And then you can see here that some of the carcinogens that we look at, the biggest ones that are coming up here are radon, where the excess cancer risk is well over 100 in a million. And so we look at those to say, these are things where we should be doing something to reduce those exposures because they are getting into an unacceptably high, from a general public standpoint, realm that warrants exposure reduction. That's not to say that we shouldn't reduce exposure to all these other things that have gray dots here, because we should. I mean, there's no safe level to a carcinogen in terms of levels of exposure. So we should be reducing exposures to all of these compounds. But this sort of is a prioritization tool to say, where are the problems? What are the exposure media that where these are demonstrating a higher than acceptable cancer risk? So that's kind of how our environmental estimates work. The other piece, of the environmental estimates are our maps. So I think, yeah, this has a little animation to it. So we have maps for all of our environmental exposures that show you most of our known and suspected carcinogens, that show you the spatial distribution by health region across Canada. So you can see this one's for particulate matter smaller than 2.5 microns or 2.5 PM 2.5. So you can see sort of where these exposures are clustering, whether that's from industrial outputs or from traffic related air pollution. These maps incorporate sources from a wide variety of sources of PM 2.5. So you can explore these maps for most of the carcinogens we have on our website. So it's sort of those excess cancer risks and the maps are really what makes up our environmental part of our website. And then for the occupational estimates, this looks very similar, I'm aware, but the estimates are actually quite different. So there's two pieces that come out of that. for the occupational side, which is a prevalence of exposure. So how many people are exposed at work to these different carcinogens, and then a level of exposure. Not everything has a level of exposure. If we don't have enough data to sort of speak to that, then they won't have a level of exposure, but most of them do. So more than half of our carcinogens that have a prevalence estimate also have this level of exposure estimate as well. And so that gives us a sense of where are the exposures high, what particular workers might be in those high exposure categories, or alternatively, for priority setting, you could say, well, let's just look at the biggest ones in terms of how many workers are exposed. So it's just a different way. Oh, sorry, I think someone needs to put themselves on mute. Thank you. So these two sets of estimates are they're quite different sort of in nature from those environmental ones, but the types of people that are working with these data and the types of sort of policy levers that exist can be quite different in occupational and environmental settings. I'm sure many of you in the room know that, and we can probably talk about some of the ways that we sort of silo ourselves a little bit too much. But I'm showing you here our estimates from about asbestos. So overall, we've actually done a recent update of our asbestos estimates. They were quite a bit lower in a previous iteration, and we always knew they were an underestimate. So we're very proud that we've updated them, and we now think that this is a much better assessment of how many workers continue to be exposed to asbestos even after the ban in 2018, just because so much asbestos remains in our built environment. So most of those workers are in construction. You can also see most of the exposures are likely to be in the low and moderate realm, but there are some groups, particularly those who are directly doing mitigation, where exposure could still be high for those asbestos exposed workers. Oops, did that skip? Yes, it did. So how has our work been used to support cancer prevention? So as I mentioned, cancer is the leading cause of death in Canada, and it is still quite preventable. About half of cancers are preventable, and a lot of those preventable causes are existing in the environmental and occupational realm. So our work has been used. We've been around for a long time. We've had a lot of these partnerships. So part of our function, I think, is just raising awareness. That's a fairly low bar, but a lot of people outside of this room and in the general public maybe aren't thinking about these exposures in the environment and occupational settings when they think about cancer prevention so much as they might be thinking about smoking cessation or alcohol or these other causes of cancer, which are super important. But I don't think that there's as much awareness of the environmental and occupational realms and how much can be contributed without having to rely on individuals making changes to their own circumstances. So these are things that can be applied more upstream to reduce people's exposures without them having to do anything, right? So that really gets at the underpinning of our partnership with CELA, because it kind of takes equity out of the equation. If we can reduce these exposures, it's not up to an individual to quit smoking or to eat more fruits and vegetables, because we know that those things really cut across intersectionalities of marginalization in these communities that are just not going to have the same ability to reduce their exposure as some others do. And so that's kind of why I'm passionate about working in occupational and environmental cancer prevention. And I think it's why, we've been able to facilitate prevention networks as well. This work allows us to identify those high-risk populations, to set prevention priorities, and it certainly has been used by our partners for those opportunities. We are really, the way that CPAC kind of measures our effectiveness now is on changes to programs, policy, and practice. So that's what we track and tell them every year. So, we know that our work was used to inform a practice change in this particular instance, or once in a while we will get a big policy change that we've contributed to, and the ban on asbestos is probably the one that CAREX contributed to the most in terms of the biggest policy change that's happened. Along with other partners from CELA to Asbestos Free Canada. There's a number of different partners who contributed to that. And I mentioned this before, but from these estimates, it's sort of the core of our research program, but we then get other grants to do different projects that are related. So maybe not about an estimate or not about a policy change, but we will, we have other studies where we're looking at air pollution exposure and other cancer. I mean, we know air pollution causes lung cancer, but it might cause other cancers as well. So we have a grant on that. I'll touch on a few other things like that at the end, but we definitely inform research opportunities, both for ourselves internally, but I would say also for others in the research community in Canada. So I've talked about this a little bit. We mobilize our work in a number of different ways, mostly through these partnerships. Our key knowledge users, of course, CELA is one of them, but a number of different ones I've kind of popped up at the bottom there, some of whom I've mentioned today. We work very closely with the Occupational Cancer Research Center, which is also based in Toronto. So that's kind of a sister project to CAREX, and they use our CAREX estimates in a lot of the work that they're doing. So through these active partnerships that, that's a research institution as well as one that does a lot of knowledge mobilization as well. So working with sort of like-minded organizations allows us to kind of move the needle a bit quicker than maybe we could just on our own. So I'm just going to talk about eWork for a minute, then I am just doing a time check for myself. Yes, we're still doing well. I will still be done in about 5 minutes, so we have lots of time for questions. But I do want to talk about eWork briefly. I know many of you in the room might work more in the environmental space, but if you do ever cross into sort of labor law and supporting workers, this might be important. And I think a lot of these things, occupational exposures and environmental exposures really go hand in hand. People tend to live near where they work. And so these exposures can kind of cross over that boundary. It's sort of an artificial boundary in many ways. So eWork is a way, when you look at the profiles, you sort of see a standalone static look at each exposure, but eWork allows you to play around and say, okay, I'm interested in diesel engine exhaust exposure, but I want to know what are the top occupations there, or where are the levels of exposure high for diesel, or what types of industries are of importance for diesel engine exhaust exposure. And eWork allows you to play around with that. And sorry, my PowerPoint is freezing on me. There we go. So this, I think, is a video. So let me just start that while I'm talking. Yes. So this just shows it in action. Showing you sort of how you can click on exposure levels to see those where they exist. You can see some of them don't exist, but most of them do. So you can kind of look at those exposure levels for each of the carcinogens that we look at. You can then go ahead and look at exposures by industry. So maybe you select, I think dioxane comes up. Yes. So we're going to look at exposure to dioxane by different industries. So you can see all the different types of industries with exposure. You can also look at it by detailed industry. So 4-digit, getting down to really the nitty gritty of the types of sectors that have exposure. You can look at it by occupation here. So if we were looking at antimony trioxide, we have the types of workers that are exposed there. You can also see we have exposure by sex that comes out there as well. And you can look at exposures by province. So pulling out British Columbia here, that's where we're based. You can look at what are the top exposures for people in British Columbia in their work settings. And so kind of things coming out on the top, like solar radiation. We do a lot of work on solar radiation, which I'll touch on at the end as well. And I think that's done that animation there. So that just gives you a sense of how to play around with that. And I encourage you to do so. I know Teresa brought this up, and so I just wanted to touch on some of the work we do with in support of Indigenous environmental health, so with First Nations primarily and health partners, although we would like to expand that out to work more with Inuit and Métis folks as well, and we're trying to do so. So one project that Melanie from my team is leading, she's on the call today, with members of the Kanesatake First Nation and our research partners at FENCI, so the Food, Environment, Health and Nutrition of First Nations Children and Youth project, led by Dr. Laurie Chan from the University of Ottawa. We have this partnership with them and Health Canada and Evict Radon to develop culturally appropriate and evidence-based tools to help the Kanesatake First Nation better understand risks associated with radon exposure. So we kind of look for these advantageous partnerships. FENCI does a lot of work in data collection for this project, but they didn't have as much time to do knowledge mobilization. So it was a great opportunity, because we do at CAREX, to make that partnership and work with a First Nation who's working on how to communicate these health risks. So, okay, you got a radon detector in your home and now you have this result. What happens after that? We also have done some work with the Aamjiwnaang First Nation and Indigenous Cancer Control Unit on Ontario Health. And so you will know in the room, Aamjiwnaang is a First Nation situated near Sarnia in Chemical Valley. And so the Aamjiwnaang have had long-standing concerns about their air quality because of the petrochemical industry, industrial exposures they live so close to. So we did some focused work with them to look at environmental quality around Aamjiwnaang, including that potential excess cancer risk due to air pollution exposures. And we developed a number of different KT products, community handouts, and digital stories to describe the influences and realities of environmental health there. And we continue to support them with one of our CAREX colleagues who's actually based at Health Canada now, Dr. Christian Larson, who's there in Sarnia right now for a community meeting 2 nights ago with the Aamjiwnaang themselves, and then last night with the community of Sarnia more broadly. So this is work that we're continuing to support. And the Ministry of Environment in Ontario, I know it has a longer name than that, but that ministry has sort of taken over to do some more exposure assessments. So it's led to some ongoing work. So we're really pleased to have been able to support that. So just a couple minutes on our partnership. I know Teresa already spoke about it, but we've had this partnership since at least 2015. I feel like it could have even been sooner, earlier than that. But we meet in a really active working group environment to exchange knowledge, expertise, and tools across our two organizations. So it's really like a circular learning. So we're learning from CELA, and I think CELA's learning from us, and we sort of have very shared priorities. These are the ones that I picked out, and I think those are most of the ones that Teresa mentioned at the top, so that's really good that we're on the same page there. So these are the types of exposures that we've focused on in the past, and I think that could really expand out. There's a number of different sort of resource uses. I know I just talked about the Aamjiwnaang work. Our estimates for benzene exposure were used there, kind of bringing out some of those ways that our work is used, but where it has been of interest for CELA and that we talk about in our working group. So, you know, both there are CAREX and CELA members of the Asbestos Free Canada network, and we know that our estimates help to inform and develop the national ban on asbestos. One thing we have done, actually a shared webinar before with IAVGO, the clinic, is we do assist workers with denied occupational disease, occupational cancer claims, and that's mostly with a contractor that we work with, Anya Keefe. And so we did that webinar in partnership with her to sort of talk about how we support doing full occupational histories for workers who've had denied claims. And so she does all of that work kind of pro bono. She's an industrial hygienist with decades of experience in sort of looking through to find out where people might have been exposed to things like asbestos, but a wide variety of exposures. And we also have some shared interest in policy analysis work. Obviously, that's like a very important to what CELA does, and we support that wherever we can. We've done some work on asbestos, on radon, on crystalline silica, diesel engine exhaust, looking at policies and how there might be policy levers for change to kind of reduce exposures. So that is all I had to say. I just wanted to mention, I'm going to stop sharing. I just wanted to mention a couple of things, touch on a couple of things that Teresa said at the beginning. So this work we have with Canoe is it's called Know Your Exposures, and it's a pilot app. It's only going to be in use for folks in our study at first, so it won't kind of be broadly on your phones anytime soon. But the idea of it is to communicate individual information about carcinogen and other exposures at work, and then also give people a sense of their air pollution exposures they experience while they're on their commute to work. So it's sort of an occupational and environmental app, and we are doing that in partnership with Jeff Brook and Danny Doiron at the Canoe Project. We also have a new grant that we're just getting started to look at the impacts of climate change on workers. So that's we're kind of marrying the two environmental and occupational pieces there together. So that might be of interest to the group. We're just getting started on that. As Teresa mentioned, and I've said radon a few times, but we do have a very close relationship with the Evict Radon National Study, which is based at the University of Calgary. We're doing a lot of work with them right now on disability justice in terms of people working from home now, especially perhaps people living with disability, working from home more now, and that's often a less controlled radon environment than maybe their workplaces were previously. So a lot of work that they're doing really overlaps with what we're interested in. And yeah, some shade equity. I know, Teresa, you mentioned shade. So we have a pilot project that's ongoing right now to look at shade availability in playgrounds for children in the city of Vancouver. We're hoping to expand that out to city of Surrey as well, but it uses a kind of a mix of ground truthing, so actually going physically to the playgrounds and doing an audit of the shade, but then also using a computer-based GIS way of looking at shade and seeing if that works pretty well. If it works close enough to as well as the in-person ones, we might expand that out to do it for cities across Canada, because if you can just do it from your desk, that'd be great. So it's a bit of a proof of concept now, but I think there's lots of different things we have worked on, things we could work on, priorities going forward. So I'll stop there, and then it looks like we still have 15 minutes for discussion. So that's great. Congrats to us for staying very well on time today.
Thank you so much, Cheryl. I found that a very, very useful presentation. I have some familiarity with CAREX's work, but I always find those, especially the maps and the tables about the environmental and the exposures, to be so helpful. I'll just add a note that I was looking over our registration to remind myself of who registered and sort of from what clinics. And I'll just give for context, I know we have folks from a number of community clinics who will be working on all aspects of poverty law. And then also a number of the different specialty clinics. So you mentioned working with IAVGO, and there's likely someone from IAVGO on the line. I can't quickly cross-reference, who's in the participant list versus who registered, but we certainly have a cross-section there. So I'm going to go ahead and pause the recording so that we can move into discussion. So I'll just say thank you so much, Cheryl, for your presentation and for all the work that CAREX does. And we enjoy this partnership so much and look forward to it continuing.
Thanks, me too.